I'm a practicing plastic surgeon in San Francisco. About 3 years ago, we noticed patients that weren't good candidates for surgery. So we started a weight management program. These medications can control your sugars, cause delayed gastric emptying, meaning you feel more full, you eat less, and you lose weight. This class of medications are called GLP-1s, actually been around for over 20 years. They were originally for type 2 diabetes, but in all these studies, they were noticing people were losing weight. It really is the biggest thing since penicillin. These medications do more than just one thing, helping people lose weight, reversing chronic kidney disease, reversing fatty liver. The FDA is going to approve these medications for those additional indications.
All right, welcome to another episode of Life Sciences 360. Today we're going to be talking about GLP-1 medications, weight loss management, and all the buzz that's around this topic. We're going to understand how these medications work. We're going to get some insights on pricing, how can you get access to these medications. I'm really excited to have this guest today here because he knows a lot about this topic. So let's dive in and have a chat with Dr. Jonathan Kaplan. Welcome to the show.
Thanks so much for having me.
Yeah, I want to start off by asking you, I know I've looked at your work, you've done some work in plastic surgery, but what really drew you to this area of weight management and GLP-1 medications?
Well, it's very much tied to my background as a plastic surgeon. I'm a practicing plastic surgeon in San Francisco, originally from Louisiana. My wife and I moved here 11 years ago. But about 3 years ago now, we noticed patients that were coming in for tummy tucks and body contouring procedures that their BMI was too high. They weren't good candidates for surgery. So rather than turning them away, our nurse practitioner suggested we start a weight management program. So we started with coaching and phentermine and the other medications that were available, even before all the buzz was going on about Ozempic and Wegovy, Mounjaro, and Zepbound. And so we started with the coaching and all of that. But then once Ozempic and Wegovy went on the FDA shortage list, that meant that, and that was around 2022, that meant that compounding pharmacies here in America could start to make a duplicate of the active ingredient in Ozempic and Wegovy, which is semaglutide. And the whole idea is the FDA wants Americans to be able to get medication even if there's a shortage. And it's not just weight loss meds. It could be, lidocaine with epinephrine. It could be Tylenol. And if there's a shortage, even if there's a patent, they give compounding pharmacies the permission to make a duplicate, just so that Americans can have access to those meds. And so that's why we were able to get semaglutide and then ultimately Tirzepatide, the active ingredient, Mounjaro, and Zepbound. We got them from a compounding pharmacy, and our weight management program exploded. And then I have a separate company called Dr. Well by Build My Health, where we were able to help all of those practices get set up their own weight management and wellness programs, and we're able to help them get access to these medications for their patients as well.
Quick word for you. Here's something interesting that my team shared with me from the back end of our YouTube channel. 87.8% of the people who've watched any of our videos throughout the lifetime of the channel have not yet subscribed. If you're one of them, we'd love to have you on board. Subscribing is free, literally costs you nothing, but it means the world to us. It helps us bring in more top-tier industry leaders and experts, and also helps us improve the production quality of our episodes. So, if you watched any of our videos before, found something valuable, or learned more about our topic or our guest, could I please ask you for a small favor to go ahead and click the subscribe button below? Thank you, and I'll repay that gesture by making sure that everything we do here gets better and better with every new video uploaded to the channel. That is my word to you. We could not have done this without you, and I appreciate all your support. Thank you, and let's go back to the episode.
As I've been looking online and going through certain, Reddit threads and other social media stuff, I see that GLP-1 is being talked about a lot as a focal point for, weight management. But for our listeners, maybe who are not from a life sciences industry background, who are not from a scientific background, how can you explain to them what's like a unique mechanism as to why these medications are effective for people?
So we'll go back a couple steps and first talk about, the human body. And when it eats, your body naturally releases these hormones. And one of the hormones is called a glucagon-like peptide, GLP. Your body naturally releases that. It suppresses your appetite. There's another hormone that the body releases when you eat called GIP. And depending on who you talk to, that either stands for glucose dependent insulinotropic polypeptide, or it stands for gastric inhibitory peptide. But either way, these are naturally occurring hormones the body releases after you eat, and they tend to suppress appetite. Maybe they don't work as well on as in everybody. But what these medications were, what they came to find out with these medications is they can also control your sugars. And so that's why this whole class of medications, even if people are just learning about Ozempic and Wegovy now, this class of medications, collectively called incretin mimetics or GLP-1s, this class of medications has actually been around for over 20 years. So they're really
Mm.
not new. And they were originally for type 2 diabetes. As I mentioned, they stimulate the pancreas to release insulin, so that controls your sugars. Um, but they also cause delayed gastric emptying, meaning food moves more slowly from the stomach to the intestines. You feel more full, you eat less, and you lose weight. So they originally indicated for type 2 diabetes as far back as 2005. The first drug that came on the market was Byetta. But again, in all these studies, all these human studies, they were noticing people were losing weight. So they eventually got it approved and indicated for weight loss back in 2014 under the name Zaxenda. And then the reason that didn't take off as much as, you're thinking about, oh, there was weight loss drugs back in 2014. Why didn't that take off then? It was because it was a daily injection. It wasn't a pill. It was a daily injection. But the reason Ozempic really started to take off in 2017, when it was first approved still for type 2 diabetes, is that was the first GLP-1 medication that was a weekly injection. And that's when people started to recognize that, okay, this is type 2 diabetes, but it also helps for weight loss. And the active ingredient in Ozempic is semaglutide, and Novo Nordisk, the makers of it, again realized that people are losing weight on this medication. So they got it reapproved or another indication for it in 2021 under the name Wegovy, same active ingredient, semaglutide, but it was indicated for weight loss, and again, still a weekly injection. And so then that's when things really took off. So even though Wegovy is the one that's technically for weight loss, everybody just collectively refers to it as Ozempic. But that's the background of these medications. Then Eli Lilly came out with a Mounjaro for type 2 diabetes, and then followed that with Zepbound, same active ingredient, Tirzepatide, but Mounjaro is for type 2 diabetes and Zepbound is for weight loss. So you can see this recurring pattern where they come out indicated for type 2 diabetes, and then they follow that same active ingredient for weight loss. But then they're finding all these other uses for the GLP-1s that it basically just suppresses your appetite, sure, but it also suppresses your cravings for other things like alcohol, maybe smoking, vaping. A really incredible medication. But back to your original question, how does it work? For the most part, they understand that it lowers the body's set weight in your hypothalamus, they believe, that makes you feel full sooner, so you eat less. But again, as I mentioned, they stimulate the pancreas to release insulin, which makes you feel full, and the delayed gastric emptying, the slowing of the stomach contents into the intestines, that also makes you feel full, which is also the cause of most common side effects that people see with these medications.
Yeah, that's very interesting how there, looks like there was 3 or 4 different paths of research or work going on from different companies, and I don't want to say accidentally they landed on this for weight management, but it appears as if it wasn't intentional, but somewhere as they were doing the research, they started finding these
Right. Well,
therapeutic
there's
benefits.
definitely, you're really right, because there's other hormones that are involved, like ghrelin, things like that, that affect satiety or feeling full. And they've
Hmm.
tried different experimental pathways with those other hormones, trying to mimic those hormones, and they were not as successful as the GLP-1. So I don't want anybody to think that, oh, they found the one hormone that does this. No, there's a lot of hormones that deal with appetite suppression, but making it a medication that you can take that's effective has not really worked for these other medications that seems like they would logically work, and they just didn't. But GLP-1s, which originally for type 2 diabetes, was really an amazing discovery. And it really is the biggest thing since penicillin. And I
Hmm.
don't say that lightly. I'm not joking. Penicillin was the first antibiotic to fight bacterial infections, but these medications do more than just one thing. Whereas penicillin only fights infection, these medications, as I mentioned, are helping people lose weight, but it's also, reversing chronic kidney disease, reversing fatty liver. And the FDA is going to approved these medications for those additional indications. Right now, you can get them off label, which doesn't mean it's illegal for you to get it for those other purposes, but they're eventually
Yep.
going to get those additional indications.
Yeah, and I think this scenario probably you come across a lot when somebody wants to start on these GLP-1 medications. You mentioned early on that when you started in this field, when you were doing surgeries, you would do tummy tucks and other types of weight loss things. So emotionally, when someone comes to you, or a person that's heading on this path of weight loss, they have really high expectations, right? And the reality is different. Not everybody acts in the same way. Somebody might drop a lot of weight in the first 4 weeks and then stay plateaued, or vice. Somebody might not drop anything for the first 4 weeks and then they suddenly start seeing the benefits. So what's one common misconception that patients have who are starting on this journey, and how do you sort of level set that to help them understand that, hey, this is not a magic pill? There's pros and cons, or there is different scenarios.
It's a great question because, yes, especially with social media, and I'm really active on TikTok and on Instagram, and patients are always talking about how they're losing 50, 60 pounds and, and
Hmm.
really quickly. And so everybody starts to think that's going to happen to them. And it does happen to a lot of patients. I'm not going to lie. It's really amazing. But there are like one misconception. I think it works for everybody, but the data shows that it really only works well for about 90% of people, which is a lot of people. There is one study that showed if you take Tirzepatide, the active ingredient Mounjaro, and Zepbound, that based on their studies, that if you during the clinical trials they did, it was for 1 year and 5 months, and they found that over the course of 1 year and 5 months, that 97% of people lost at least 5% of their body weight. So that's pretty good numbers, 97%. The thing is, though, you start to wonder, because of the cost of the medication, that if I'm only going to lose 5% over a whole year and 5 months, is it really going to feel like it's worth it to you? Now, maybe you would have gained 5% if you hadn't been taking the medication. So losing 5% is great. But yes, unfortunately, people come into this thinking they're going to lose 20, 30% of their body weight. So you definitely have to recognize, let people know that it's not going to work as well for them as maybe what they saw on social media, but it's going to work to some extent for most patients. They just have to remember that they probably would not have lost any weight, and certainly would have gained weight if they hadn't have been on the
Hmm.
medication. So even if you don't lose 20%, that 5%, 10%, that's great. But also it's if you're type 2 diabetic, it's lowering your hemoglobin A1C. Even if you're not seeing weight loss, the other things to look forward to are craving other addictive behaviors, but also, and it's a little bit more nebulous, is that has this anti-inflammatory effect that they don't exactly understand. So people that, even if they're not losing weight, they're showing data that it's reducing cardiac disease, it's reducing joint pain, even without weight loss. So there are other benefits outside of weight loss. And again, most people are probably just want weight loss, but there are other benefits, even if they don't see those numbers that people are seeing, or that people are talking about on social media. So you definitely have to have a realistic conversation and realize that even if they don't lose 30 pounds, they're going to see other benefits. They're going to probably feel better about themselves. They're going
Yep.
to maybe fit in an airplane seat a little bit better. Um, Maybe they might not get down to a size 0, but there's going to
Hmm.
be typically statistically improvements.
Yep. Yep. Yeah. I mean, weight loss is one of those areas that's so different from anything else, because there's so much psychological stuff attached to it. There's so much emotion. There's social status. You if your friends are skinny, you want to fit. Like it's very simple, but at the same time, it's one of the most complex things that every human being at some point in their life, either they're trying to gain weight, or they're too anorexic or skinny, or the other side where they're obese, and they've been told, like, they've tried a bunch of diets and gyms and whatnot, and they might suddenly feel like this is a solution to everything they've tried, and that's failed, right?
It really may be the solution. Statistically speaking, it's probably
Yes.
is going to
Yeah.
be the solution to help them get to where they want to be. And certainly, diet and exercise, while that's always been told to us as that's the best way to lose weight is diet and exercise, we're realizing that's probably not the best. That's not the easiest way to lose weight. And it's probably not that
Yep.
effective, because even if you lose weight with diet and exercise, your body set weight, that thermostat is pulling you back up and you eventually regain that weight. Whereas with these medications, that can help you keep the weight off. But it's still important to continue with diet and exercise because you're eating less. You also may be drinking less. And so that's, you're drinking less fluid. So you might get dehydrated, but because you're eating less, you need to make sure you're still getting in the protein every day that you need.
Mm.
So the diet is important as far as, high protein diet to get those same caloric needs, but also the exercise is important because any type of weight loss, not just with the weight loss meds, but any type of weight loss can lead to lean body mass loss, which is like a reduction in muscle and bone. People think that it only happens with these meds. It happens with all type of weight loss. So exercising is the best way to mitigate or minimize that lean body mass loss. So diet and exercise are still extraordinarily important, maybe more important, but not for the reasons you think. It's not to help you lose weight or keep the weight off. It's really to make sure you're getting in the nutrients you need and to help minimize or mitigate that lean body mass loss that
Yeah.
everybody is so worried about.
Yeah, I want to switch gears and I want to talk a little bit about, because probably whoever is listening to this, they're wondering, okay, if they want to start, taking these medications, what is, you mentioned some, and I know that you are offering these through Build My Health. Is that correct? This.
So that's the name of my company. It used to be Build My Health. Now it's Dr. Well by Build My
Yep.
Health. And so if people go to drwell.com, they can find our providers across the country. We cover all 50 states, but you can find providers there that are able to do a virtual or in-person consult with you, depending on where you live, and then allow you to sign up online for these medications. And you're charged each month like a subscription. And then each
Mm.
month the medications are shipped to you, and you can choose between Semaglutide, Tirzepatide. There's all other sorts of peptides available, NADs, Somorelin, there, a lot of things that people, B12 vitamins that you can sign up for as subscriptions. But we make it very easy, and it's out of pocket. Insurance doesn't cover it, but it's significantly less expensive than the name brand drug, which statistically speaking, your insurance is not going to cover this, or they're going to put up so many barriers and hurdles that you're not going to be able to get the name brand drug. So by getting it through us, through a compounding pharmacy, much less expensive, but also the convenience of it being shipped to you rather than having to drive around town or to other states, what I've heard from some patients, where they're trying to find the pharmacy that has the name brand drug in stock because there is such a significant shortage.
And what's you mentioned about subscription and being charged like per month. So I've also read that you talk a lot about how you were so excited in building this unique pricing, transparent pricing model.
Right.
So can you walk us through like what were your thoughts when you were building this out and thinking of how the patients are gonna pay for these?
Well, so each provider in our Dr. Well network, they can choose what they want to charge.
Hmm.
But in my practice, what we do is the semaglutide, the active ingredient in Ozempic Wegovy, is $500 a month. And that includes not only the medication, which is, it's a once per week injection, 4 times a month. So it's enough for 4 injections. But also that $500 in my practice includes virtual coaching. You can meet with our nurse practitioner for coaching on diet and exercise at least once a week. It also includes all the medications for any of the most common side effects. So if you're having nausea, we can mail you some Zofran. If you're having constipation, we can mail you some magnesium tablets. If you're having sulfur burps, we can mail you ginger chews. So we're including that, the cost of that in there as well. And I know that you can go to the pharmacy and get Zofran, but you still have to have the prescription called in. You got to go wait in line at the pharmacy. So we make it easier for the patient. That $500 for the semaglutide includes the Zofran and those other treatments. For Tirzepatide, the active ingredient Mounjaro and Zepbound, that is $600 a month, and that includes the 2.5 up to 10 milligram dose. So that's the pricing that we offer. Now, it gets a little bit better that, if you're in our program for at least 6 months, you're not locked in by any means. These are month to month subscriptions. You can cancel anytime. But one of the things that we offer is that if you happen to be in for more than 6 months, well, after 6 months, we're probably not providing you as much coaching as you once were. You probably got all the coaching tidbits you got in the first 6 months. You're also probably not having side effects anymore because in general, the side effects are mild, treatable, and time limited. They eventually go away. So after 6 months, there's a little less involvement on our part, not because we're telling you can't call us. Obviously you can, but there's just less involvement. The patient needs us less. So after 6 months, we reduce those prices. So the $500 semaglutide goes to $400. The $600 Tirzepatide goes to $500. Then that's to continue getting the 4 shots a month. The other thing is that when patients get to their goal weight, they can stop these medications, but statistically speaking, they'll regain some of their weight. Studies show that they'll regain about 2/3 of their weight over the course of the year. So not all of their weight back. So that's good. But if they are worried about regaining, then they can switch to a maintenance subscription, which means that you don't necessarily need 4 shots a month to lose weight. Maybe you can get away with fewer shots a month to maintain your weight. And so patients know what will work for them. And so in a little bit of trial and error too, that they can switch to a less expensive subscription where they're maybe getting only 3 shots a month or 2 shots a month or 1 shot a month. And then they can do that for as long as they want at a lower price point. And that can get down as low as $299 a month if we're talking about pricing and everything. So I'm not saying any of this is cheap, but it's certainly less expensive than trying to pay for the name brand drug out of pocket, because that's all over $1,000 a month. And you have the added hassle of trying to find the medication. You just can't get your hands on it.
Right. And so for you and the people, like the other providers in your network, when you're operating a practice that's, you don't take insurance, it's cash, you pay per month, and you stop it when you don't. What are the challenges running a practice like that versus somebody that's billing to the insurance companies?
Oh, wow. How much time do you have? So billing to the insurance company it's such a hassle. We do support that in our practice. We're piloting a program right now where if somebody meets certain criteria, like we're not just going to try to get your insurance to cover it, just, if you're trying to lose 10 pounds, we just know that's not going to get covered. So when it comes to insurance, things that you absolutely bare minimum parameters that you have to meet to make it even possible or feasible or like it's worth trying is that you at least have to have a BMI of 27 with an obesity related condition like sleep apnea or high blood pressure, diabetes. So a BMI of greater than 27 or a BMI of greater than 30 with no obesity related conditions. The other thing is that you have to have private insurance, something like Blue Cross Blue Shield or Aetna. It can't be Medicare. And what we have found, at least in California, it can't be Kaiser. Kaiser does not cover these medications. They actually just had like over $500 million. I think it might have been a $608 million shortfall in their budget from the last quarter. And it was mostly because of the expenses of covering Ozempic and other medications for type 2 diabetes. So they don't want to cover these medications, especially for weight loss. So for insurance, yes, if you meet those certain parameters, BMI greater than 27 or 30, private insurance, then we can try it. We can fill out the paperwork for you, the pre-authorization, the benefits assessment. The problem with it is that it's going to maybe take either days, weeks, or months to find out whether they're going to cover it. But then what's even crazier is they'll say they cover it, but when you go to get the name brand drug at the pharmacy, they'll say, oh, well, your copay is $1,000. Like, well, how are you covering it if it's still $1,000? So for those patients, we, since we're still charging them monthly just to do the process of the pre-authorization and everything, that if they still can't get the name brand drug, even if insurance claims they covered it, they can't find it, or the copay is too high, because they're still paying us the monthly fee, they just fall back to the compounded medication. So we still can get it from them. The point is that if they're going through us, whether they're trying to do insurance or not, we're guaranteeing them access, either the name brand through insurance or the compounded version. So they won't walk away empty handed. But the other problem with insurance is that just because they might approve it, and let's say the copay is really low and it's a great deal and you're getting it, they may require pre-authorization again in 3 months, and at which time they're not going to probably cover it again. So those are all the pitfalls with insurance. And all that time you were struggling to get insurance to cover it, and maybe it's been like a few months trying to get them to cover it. Your friend who was on who just decided to pay less and out of pocket for the compounded version has been losing weight for the last 3 months while you were waiting to try and get this covered by insurance. So it's pretty frustrating.
Yeah, definitely. I mean, the timing and the speed of getting access to the medication, that's I mean, it's common for anything, right? Like if you can get it, and there's also not for GLP-1, but like even other medications and different countries. Like I know I'm originally from India, and there are a lot of medicines in US where you need a prescription, but in India you don't. Like you just need to go to a doctor, and they don't give you a prescription, but it's very different, right? I don't know how other
Right.
countries work, but in India, I've observed. I'm like, wow, this is just an allergy medicine, and here in US, I have to go get an appointment, then wait for the medication. In India, I could have got that like just by walking to a pharmacy and telling them, hey, I need an allergic, medication. So,
Right.
um, I want to talk about ethics, right? Because with the popularity of GLP-1s and all the buzz that's going around, and the demand or the people who want to have access to these therapies so that they can, reach their weight loss goals, I'm sure there are ethical ways of approaching this and unethical ways. And how do you maintain that line to say, okay, this is something that we won't do, and because it doesn't fit our brand or it doesn't fit our moral values?
We definitely would not prescribe this or offer this medication to anybody that has any of the black box label warnings like medullary
Mm.
thyroid cancer or a history of medullary thyroid cancer. But more to your point, if they have a history of an eating disorder, we would not offer this medication to them. If they have a history of pancreatitis specifically due to these medications, we would not offer it to them. But getting into the patients that are, just trying to lose 10 pounds, or they're trying to lose weight before their wedding, or they're trying to, lose weight before a vacation,
Yeah.
that is not what the medications were intended for. But we will prescribe it for that. And people may find that that's unethical. But the truth is that they can either get it from me, a real doctor that's going to prescribe this to them, and we're going to follow them and make sure they're doing all right and make sure that they're not dropping too much weight. Or if I refuse to work with them, they're going to go online and get the medication from a pharmacy that sells research grade medication, which is not
Mm.
intended for human use. And they can actually get that without a prescription. So it's not illegal for the pharmacy to sell it to somebody if they're claiming they're using it for research use. It's just, it's not meant for human use. And so there's fewer quality controls. You don't know how many impurities are in there. So if we have patients who are using this to lose a little bit of weight that, people might shame them on social media, my feeling is that they're much safer getting it from me, from a legitimate compounding pharmacy that's getting it from an FDA registered manufacturer, that our whole supply chain is legitimate, that they're safer getting it from me for those reasons than me turning them away and them going and getting it online, when it might be unsafe for them to take. So that's how I
Yeah.
feel about that. And sure, it doesn't meet their BMI criteria for it, but again, that's considered off-label prescribing, and that's again not illegal. And I'm feel very comfortable with doing that. I know that we're trying to help them, and also a little bit of human nature, that there's something out there that works as well as this, and to tell a person, "Oh no, you can't have it," though, that's not going to go very far. Again, they're going to find a way to get it online in a more unsafe situation. So we do prescribe it for patients, regardless of their BMI. We still get their baseline lab work. We still do a virtual or in-person consultation. We're still showing them how to do the injections. So we're doing everything appropriately to make sure they're doing this as safely as possible. But again, if they, the main thing is if they had a history of an eating disorder, that would be very concerned. I would not prescribe it for that. I would not prescribe it
Interesting.
to them for weight loss.
Yeah. Yeah, that's interesting. And when you, as an expert in this field, everything you've shared so far, it's evident that you've been in this space for a long time, and you've come across all types of cases. But when you look at the broader impact of public health or obesity related conditions and statistics around that, what do you think uh, GLP-1s, are they going to make those statistics look better in the next 5 or 10 years? Or do you think there's any other developments in cosmetic medicine or weight loss that's going to happen, that's going to sort of move that needle?
these are certainly changing the face of the country, the world, economics. I mean, there's one study out there that shows that if all United Airlines passengers lost 10 pounds on these medications, they'd save $80 million in jet fuel cost over the course of a year. I mean, this is really
Wow.
changing everything. It's already changing healthcare, because the thing is, if you think about healthcare in America, all of the different providers out there, all the different doctors out there, they're treating something, they're treating, they're treating essentially the symptom of the underlying cause, which is obesity. So take, for example, as a plastic surgeon, we treat obesity. Patients are going to have better results from their cosmetic surgery. But if you look at an ear, nose, and throat doctor, instead of treating sleep apnea with a CPAP machine, they're going to treat their underlying obesity, and they're going to get rid of their sleep apnea. If you take a urologist, even, who is been treating erectile dysfunction, they're going to treat the obesity. It'll get rid of their erectile dysfunction. Even a dermatologist, instead of just treating everybody for acne, they'll treat their underlying obesity, and that's going to clear up a lot of acne. So many things in America, including, OBGYNs treating infertility. So many things that we're treating, or we're really just treating the symptoms. And if we get to the
Mm.
underlying cause, which is in so many cases is obesity, it's going to totally transform healthcare. And that's why we're all obesity doctors now. And that is really
Yeah.
the bottom line. Every doctor in America, around the world, well, especially in America, we're obesity doctors now, because we have in our armamentarium now, we have these great medications, which, yes, there are some potential very serious but rare side effects. For the most part, they have incredible, great safety profile, very effective, very safe. And so even if you're not an obesity medicine specialist, you still, first of all, there's not enough obesity medicine specialists to go around, but that's why it's so relatively safe for all providers to offer these medications, because it's really going to treat and improve the quality of life and the health of Americans, while we're in a parallel path, also
Mm.
trying to improve the food chain and trying to get rid of processed foods. And you
Yep.
know so there's other things that we can definitely be doing at the same time, but those are sort of generational changes to improve the food supply in America. But in the meantime, we have these medications to help people lose weight, hopefully live longer, reduce their risk of major cardiac events, potentially stave off Alzheimer's disease, slow Parkinson's disease. I mean, it's
Yeah.
unbelievable the amount of data and studies that keep coming out showing what the benefits of these medications are.
Yeah. You mentioned about, the food chain and going towards less processed food. So I'm just curious, do these GLP-1 medications, when people take them, do those patients see any improvements in their gut microbiome or those kind of things?
Well, one thing that they certainly are doing is that it's helping people crave reduce their craving for sugars, and that's why a lot of
Mm.
companies are losing market valuation. Whether they really are seeing a decrease in sales, that remains to be seen. But it's definitely curbing people's appetite for sugary foods, and so I
Yeah.
think that's going to also prompt these companies to change what they're offering, because the consumer appetite is going to decrease for that. No pun intended.
Yeah.
I mean, just another way that the medications have changed certain businesses or business models is that bariatric surgery, stomach stapling, gastric bypass, the rates of that operation have plummeted because people are taking these medications and losing weight now. And there's
Yeah.
additional medications that are in the pipeline that are going to lead to a bariatric surgery type of weight loss without the surgery. So it's already changing a lot of business models and the economics across the entire spectrum in the U.S. So it's very exciting to see
Yeah.
how it's changing.
Yeah, and even as a consumer, I remember, I moved to US in 2007 from India, and I, when I go to the grocery store today and reflect, how it was when I went to a grocery store in 2007, when I was staying in the dorms with three other roommates. You're seeing a lot of labels with big statements or big letters that say no added sugars, because it's the added sugar that's actually killing us, right? Like 20, 30 grams of added sugar in like a small drink or a protein bar or some kind of stuff. If you have those every day, 5 days a week, that's 150 grams of sugar. And you don't realize how much that is. I actually weighed
Right.
it one time and I saw it in a cup. I'm like, wow, that's a lot of sugar.
And people wonder why they're insulin resistant now, which is
Yeah.
these medications also help with your insulin sensitivity. But you mentioned the grocery store. You're going to see more and more of this where you walk in and instead of like necessarily the ethnic food section or that food section, there's going to
Mm,
be a GLP-1 section that's going to be high protein foods. You're going
wow,
to start to
interesting.
see that. You're going to see that. I mean, I'm already seeing that, but you're going to start to see it all across America. And there's companies that are already promoting their products that are high in protein, low in sugar, and maybe those were foods that were available before, but they're just relabeling or rebranding them as being GLP friendly.
Yeah,
But
yeah,
it's already changing everything. It's for the better. It's very
yeah,
exciting.
yeah. When you look back at your career, like everything you've done, the work you've done in plastic surgery, and then weight management to now what you're doing with GLP-1 medications, going on podcast and interviews and spreading the knowledge. What's one thing that you're most proud of when you reflect on your career?
I think one thing I'm proud of is recognizing the change in the direction of what was available out there, to recognize when it was time to not necessarily pivot, because I'm still a plastic surgeon. I still
Yeah,
enjoy operating on patients, but recognizing those changing currents, those changing winds of like recognizing those opportunities. And as a surgeon, it's really fun to operate on a patient and then they wake up and then they have perkier breast or a flatter tummy, and they're happy even though they might be in pain right after surgery. They're happy because they can see the improvement already, and that's very gratifying for me as a surgeon. But there's only a certain number of operations you can do in a week for that gratification, that instant gratification. Whereas now that we're also offering these weight loss medications in our practice, now we're treating hundreds of patients a month that are losing weight and that are happy and that are writing nice reviews and that are calling us. And when we see them in person, they tell us how happy they are and how successful their weight loss has been. And so that's been great for me. That instant gratification of only several operations per week. Now it's hundreds of patients a month that
mm,
I'm getting that instant gratification of seeing how they've done better. So I'm really happy that I was able to recognize that changing course, that changing opportunity, and take full advantage of it.
yeah, yeah. And for listeners, and viewers, if you enjoyed this conversation today, be sure to click the like and subscribe button, or follow us on the podcast platform so we can constantly bring you amazing guests like Dr. Jonathan and go on these trending topics, because that's what this podcast is about. So I look forward to hearing your thoughts and comments and what you would like us to cover in the next episode. Dr. Jonathan, it's been amazing. I know we had some hiccups starting this session. I was like, please, I don't want this to be canceled because I really want to talk to you. So we finally got it going. And before we drop off, how can people get access to you? Can they follow you on social media? Can they learn about your companies? Do you want to share those details?
Absolutely. So they can certainly reach out to our website, drwell.com, drwell.com, just like it sounds. And then they can also find us on TikTok and Instagram at drwellrx.
Yep.
They can also just email me if they have any questions. Certainly the easiest way is to DM us on TikTok or Instagram, drwellrx, but also they can email me at drkaplan at drwell.com. That's drkaplan at drwell.com. And I'll be happy to answer any questions. If there's any providers out there that want to be part of our platform, our provider to consumer platform, we'll be happy to help onboard them as well so they can serve more
Yeah.
patients.
So before we drop off, and anyone that's, whoever is listening to this episode, whether they've already taken these medications or are currently taking these medications, or maybe after learning from all the insights that you've shared in this episode, maybe they are interested in going and pursuing to take these medications for weight management, whichever category they are in, what's kind of one takeaway that you want to leave them with before we drop off?
Well, so obviously that they need to be concerned about the different online platforms out there that where you can sign up for these medications and you don't really have a provider, like the direct to consumer platforms like
Yeah.
Roe or Hims. And I understand that it's easy to sign up for the medications, but the problem is your relationship is with a website, not with a provider. And so that's
Mm,
kind of our alternative that we offer, is instead of a direct to consumer platform or a provider to consumer platform, so that you still have the same ease of signing up online, but you have a provider, a healthcare provider, might even be the provider you already have, that can help continue to watch you and follow you through your journey, be available for you if you have any side effects, rather than calling some 800 number and somebody telling you go to the ER for everything. This
yeah.
way you actually have healthcare provider to follow you and take care of you. And so it's a much more um, honest and sustainable way to take these medications, because you have that continuity of care with a
Yeah.
healthcare provider rather than just a website.
Absolutely. Yeah. It's kind of like the happy medium. You're not like going to a doctor, waiting for a prescription, paying extra to insurance to cover all the cost of the insurance and the pharmaceutical companies. But you're also not just, going to a website where you don't have any, supervisory role, or you can't call a person, like you said.
Yep.
So what you're doing seems like to be the happy medium in between that ultimately gives them access to the medication faster and at a cheaper price.
Exactly. You get it. I mean, you get what you're looking for. We make it easy for you to get it, but we have that connection with the provider ongoing. And again, it's
Yeah.
not like some independent contractor that you may talk to a different provider each time. This is your doctor.
Okay. Interesting. Thanks again. This has been amazing. I have learned a lot. There was a lot of noise in my head about this topic by consuming stuff online, but after this episode, I think I know what's the real stuff and what's noise. So thank you for being forthcoming
My
and sharing
pleasure.
everything. Yeah. All
Thanks
right.
so much for having me. I really
Thank you.
enjoyed it.
Thank you. Bye.